My name is Dr. Macy Hogan. I'm the lead therapist for the Transplant Optimization Program, as well as one of the lead developers of the program. So Transplant Optimization Program, or TOP for short, began 2 years ago. So when I was hired on here, it was my goal to start this program with the help of Dr. Menza to try to expand the services that we offer for our patients that are going through a bone marrow transplant, and that it could really improve the outcomes based on what the research was saying about other programs like this in the nation. So we got to work and started it and have seen awesome growth in the last 2 years. So really with this program, what we do is we try to get your baseline before you go through transplant or CAR T, give you supportive services through the cancer treatment, and then for any need to rehabilitate after going through these advanced therapies, we also provide those services. So from physical therapy standpoint, treatment's really broken down into a couple main categories. Cardiopulmonary is a big section of that. So we usually issue a walking or biking program, and I give specific education on how to. We also do strengthening, mostly working on, from a physical therapy standpoint, mostly working on lower body, core, those sorts of things. But yeah, nothing I would say it's crazy intimidating or anything. And then I also treat any other comorbidity that comes along with your life that you've already been living. So yeah, we're happy to offer lots of different variety of services to address different components that supplement the medical treatment that the doctors are doing to kind of take care of these other aspects of a patient's life that are impacted by these advanced cancer treatments.
So we try to refer almost all our patients as much as possible for an initial assessment at least. Our therapist will tell us whether this patient needs to continue doing therapy or not. Most of the time they do, as one would expect, and they do a good job with individualized therapy programs to ensure that our patients are optimized. And so they work with you during your hospital stay, and also when you are discharged, you continue to ensure that you make a seamless transition back to the life that you really want to live, and to be able to go out there and do the fun things that you always wanted to do before the diagnosis.
TOPS program, or Transplant Optimization Program, is a unique program that we established here at the Franciscan. So we have a team of physical therapists, and we have a team of navigators and the nursing staff which take the patient through this TOPS program and essentially accomplish this so that the patient can get through this treatment in a safely and timely manner.
We've had many patients who see us the first time they come to see us. They're in a wheelchair or using a walker, and that's not an ideal situation for an aggressive treatment. So trying to get those patients in more fit condition, we've worked with our physical therapy, occupational therapy, speech therapy colleagues, and they've been very receptive to this idea of let's have a transplant-focused method to enhance outcome.
What I would say to any patient who is hesitant about coming to TOP is, first of all, regardless of your status, we would benefit from getting a baseline for your functional status. And usually that's better to get, if we can, before you actually go through an advanced treatment like CAR T or transplant. The second thing I would say is for patients who are wondering if they can tolerate it, just maybe their previous chemotherapies have kind of knocked down their functional status, or maybe a patient's never participated in an exercise program formally or any sort of physical therapy. I would say that in fact, you might need it more, just because this process of transplant and CAR T and all these advanced therapies that we offer to treat bone marrow cancers can be very hard on your body. So, and the other thing is that our exercises that we do really are very valuable to you from a functional standpoint. We're doing things that translate into movements that you're doing in your everyday life that you may or may not currently be struggling with, you may struggle with in the future. It gives a great base of education, as well as helps you to really feel confident and independent with being able to manage this part of your care yourself, starting with some guidance from our team. I think it's a really worthwhile program. I've not had anyone in the 2 years that I'm doing it that's went backwards while doing therapy specifically, or that hasn't benefited in not only from the numbers, but also just their reports of what they're doing in their life, what they were not able to do before coming to TOP, what they're able to do now with their families around their home, in the community. It really changes people's ability to get back to their normal lives sooner after going through, this massive undertaking with treatment for bone marrow cancers. For my patients, what I have noticed is that most people, if they get therapy prior to undergoing transplant or CAR T, they do better when they come see me afterwards.